Hello students, today's topic of discussion is the parathyroid gland, another important topic from the chapter of endocrinology. Parathyroid gland, they're four in number and located just behind the thyroid gland as shown in the image. This is the thyroid gland which is shown in the pink color, and these are the parathyroid glands which are shown in red color. Parathyroid gland, it is an important major gland that is involved in the regulation of calcium in our body, and they secrete parathyroid hormone, which is synthesized and secreted by chief cells of the parathyroid gland. It's a major hormone for calcium ion regulation. Now the stimulus for secretion, that when there is decrease in serum calcium level, the parathyroid gland is stimulated to produce parathyroid hormone. Actually, this is controlled by the serum calcium ion binding to calcium ion sensing receptors in the parathyroid gland's chief cell membrane. Decreased calcium binding to the calcium ion sensing receptors that will stimulate the parathyroid gland to secrete parathyroid hormone. The second factor is the mild decrease in the serum magnesium level, and severe decrease in the serum magnesium, it inhibits PTH secretion. That's important for MCQ, that if there is mild decrease in serum magnesium, it will it's a stimulus actually for the secretion of parathyroid hormone. But when there is severe decrease in serum magnesium, that will inhibit the PTH secretion. So the action is opposite in case of mild decrease and severe decrease in the level of serum magnesium. The overall action of parathyroid hormone is to increase the serum calcium and decrease serum phosphate. It acts on three organs. The mechanism is as follows: like when there is low concentration of calcium in the blood, the parathyroid gland is stimulated. It causes the release of parathyroid hormone. Parathyroid hormone, it acts on the bone and causes increased bone resorption, that causes the efflux of calcium from the bones, as well as the phosphate, because alone this effect on bone would not increase the serum ionized calcium ion, because the phosphate complexes the calcium ion, so brings both calcium and phosphate from the bone mineral into the extracellular fluid. Then its action on the kidney, causing increased renal calcium reabsorption in the distal tubule, which will increase the serum calcium. And finally its action on the intestine, increasing intestinal calcium absorption indirectly by stimulating the production of 1,25-dihydroxy cholecalciferol in the kidney, or through vitamin D, enhancing the absorption of calcium from the intestine. So these are the three mechanisms acting on the bone: increasing the resorption, acting on the kidney, distal tubule of the kidney, decreasing the loss of calcium in the urine and increasing the reabsorption of calcium. Then acting on the intestine through vitamin D and enhancing the absorption of calcium from the intestine, resulting in increased concentration of calcium in the blood. So all these three mechanisms, these are processed through the parathyroid hormone, which is secreted from the parathyroid gland when it is stimulated due to the low level of calcium in the blood. Let us summarize. The parathyroid gland, 4 in number, located behind the thyroid gland, releasing the parathyroid hormone, synthesized and secreted by the chief cells of the parathyroid gland. Stimulus is the decrease in the serum calcium level or mild decrease in the serum magnesium level. Actions are on bone, on kidneys and the intestine. Acting on bone, increasing the efflux of calcium and through bone resorption. Acting on distal tubule of kidney, increasing the renal calcium reabsorption and decreasing loss of calcium in the urine. And acting on the intestine through vitamin D, increasing the absorption of calcium from the intestine. Let me give you a concept of positive calcium balance and negative calcium balance. Positive calcium balance is seen in growing children when the intestinal calcium absorption, it is more than the urinary calcium excretion, and the excess of this calcium that is deposited in the growing bones. So that takes place in the growing children. There is positive calcium balance. And what's negative calcium balance? It is seen in women during pregnancy or lactation when the intestinal calcium absorption is less than the calcium excretion, and the deficit comes from the maternal bones. So that's the concept of positive calcium balance and negative calcium balance. If you like my video, please like, comment, give me your feedback, and see you with the next video. Thanks for watching.